My name is Linda Paul, and I'm here to talk to you about my journey with malignant melanoma. Not only the fact that I had melanoma, but the fact that I had it on my face, which of course is a huge concern to people. Certainly, some people have had serious complications with melanoma. I know somebody that lost their entire nose, has a prosthetic device, and it looks pretty good, but I'm sure most everybody would prefer to have their own nose. I also have an in-law that lost his entire ear, and a cousin that ended up having extensive surgery on his shoulder and even lost some use of his shoulder, and then followed that up with chemotherapy. So melanoma is a serious skin cancer, actually the worst out of the types of skin cancer. There is also basal cell carcinoma and squamous cell, but melanoma by far has a higher fatality rate. So my story started about maybe 3.5 months ago when my husband just looked at my face and he noticed that this brown patch that I had on my face for actually several years, a patch about, a little smaller than a dime, kind of a normal aging spot that we would think of. He looked at it and said, that just doesn't look the same as it used to look. And it drew my attention to it because, for a couple of reasons. One, I've never been a sun worshiper. Only when I was a teenager and I went to the beach, that sort of thing. But since that time, I'm rarely out in the sun for any extended period of time without a hat. I have to confess that I never have used sunscreens very much because I'm allergic to most of the ingredients that you find in most common sunscreens. Since then, I found out there are some types you can get that wouldn't necessarily cause that problem, but nonetheless, my history in the sun is minimal, and I was really kind of concerned then when I took a really good look in the mirror and went, that does look different than it had been looking during the past few months. So I can look back and see pictures actually where it looks completely different just 1 year previous. So I went to the dermatologist, did a full body check. The dermatologist did look at that one on the face and went, I think we really do need to do a biopsy just to play it safe. Much to my surprise, when the results came back, it was malignant. I was lucky we caught it early because it was a malignancy in situ, meaning it didn't appear that it had extended very far. So this is the results of my test. And as you can see right here, malignant, and a little more of a description right here. So I got set up for a process called Slow-Mohs. It's a procedure that's been used for excising skin cancers for decades, actually. But it is especially concerning when it's on your face because, like anybody, you're concerned about what it's going to end up looking like. Now, I'm going to show a series of pictures, so I'm going to give you the warning right now that if you're squeamish, you might have some concerns about looking at these pictures, but I'm going to start off by saying that it's been about 2.5 months since I had the procedure done, and look at my face, looks pretty darn good. It was right there. And what really surprised me, though, is thinking that they would cut a circle to excise that lesion, and somehow they'd sew it up. But that's not how it goes. And fortunately, I did some research in the beginning So I knew what to expect, because I can tell you, had I not known what to expect, boy, would I have been surprised. So that's why I'm doing this. So not only can you know what to expect, what the procedure is, but you can also know that despite the fact that this was a potentially disfiguring surgery, that, and I frankly expected that I wouldn't look normal for at least a year. And it's only been 2.5 months, and holy cow, I do have a little foundation on my face, but you can see, and I'll try to get as close as I can. There's hardly any scar. And when you see how big the scar was, you're going to be shocked. By the way, little disclaimer, I already had a scar on my face. You can see some traces of it there. That's an old scar. But even so, this procedure that I underwent, two-part procedure with the surgery and a follow-up laser treatment of a, what do they call it, a microneedling procedure. It also improved the appearance of my old scar. I'm going to be showing you a series of pictures. The first picture I'm going to show you is what this spot on my face looked like about a year previous. So this would be roughly the October or September of 2020, when I did go to the dermatologist, and it didn't look like it was anything to be concerned with. So that just goes to show you how quickly things can develop, because looking back at old photographs of myself, I can see the transition of that spot changing from a typical looking age spot to what it looks like in the next picture that I'm showing you, where you can clearly see that there are two very dark spots that have kind of, I wouldn't say taken over the area, because the rest of the age spot kind of faded, and these two dark spots became very prominent. Following that, the next picture I'm going to show you is the plan for excising what they call the lesion. So it shows where the spot is in the margin that we're going to remove. And then following that, and graphic warning, if you're squeamish, you might want to fast forward through this next section, because I'm going to show you the hole that was created by the surgery. So as you can see, it's about the size of a quarter. And from that, of course, the surgeon, who is well versed in also plastic surgery techniques, knows that you just can't pull those edges together without it puckering. So my next slide to show you is the plan for removing a crescent shape out of my skin, so the edges of the remaining skin can be drawn back together in a single line instead of a puckered hole. A bandage was placed over it while they sent the sample out for testing. Now, I understand that some dermatologists have that testing right in their facility, but in this case, they sent it out for an overnight analysis. And instead of having to sit in a waiting room for hours while they treat and stain and evaluate my sample, they simply put a bandage on my face. It's a pressure bandage, and that held everything in place for overnight. The laboratory would have assessed whether or not we had what is called clean margins. That is the depth of the lesion and the width of it, that we got a margin that's acceptable, that they would not have to remove any additional skin. If it had spread, then I would undergo another surgery where they would remove a little bit more to attempt to get those clean margins. And again, they would have sent it out for another overnight procedure. In my case, I was fortunate that they did get it out in the first try. Finally, the doctor sutured the wound, and this picture shows how it looked after he had done all the stitches. And you could see that it's pretty prominent and a little scary. That scar is about roughly 2.5 inches long. So it was concerning, of course, but I do have to say that during this entire procedure, I felt absolutely no pain. And I think that's important to emphasize because it does look like it would have been painful every step of the way. Now, can I say nobody would feel pain? I don't know. I might have a pretty high tolerance for pain because I've had liposuction in the past and also experienced no pain, but I have friends that said that they did. So please don't take this as an absolute that should you do this, that you would not experience any pain. I can only speak for myself in this circumstance. So my instructions were to come back in, I think, 5 days to have the stitches removed. I don't remember exactly if it was 5 or 7 days, but at any rate, during that time, I had to put a lubricant on my face, which would be either Vaseline or Aquaphor. And fortunately, Aquaphor is easily obtainable, just as Vaseline is, and I did choose to use that. And I did that for 10 days, even after the stitches were removed. They expect that you're fairly well healed after 10 days. So then I switched from the Aquaphor to a product called Scaraway. And Scaraway also is easily obtainable from your local grocery store or pharmacy. It is a silicone gel. They also have silicone pads. In my case, they recommended the gel instead of the pads, but I did kind of intermix both, and I really found that the gel, which is in a tube with a little roller, so you roll it on, is just easiest to use. Being an awkward shape, if I obtained the silicone pads, I had to cut them to fit, and it was a little tricky to do that. They're really kind of a little hard to cut a small shape out of. And so I was thankful to have the gel form to use on a regular basis. At the 6-week mark, they had me come in for a procedure called microneedling. It's a laser type procedure. And what it does is it puts tiny little holes in the area that they treat. And those tiny little holes, when they heal up, they actually blur the appearance of the incision, lessening the visibility of the scar itself. It was surprisingly uglier, I would say, than the original procedure itself, because it is kind of a little oozy, bloody, and I'm showing you a picture of what I looked like after that. And so surprisingly, I had a public event to go to, and I had to cover that. So it wasn't too surprising for people to see. My next few pictures are at varying intervals after the surgery and the microneedling, what it looks like as it heals. So I was pretty pleased right away that it was very easy to put the Scaraway gel on, put a little makeup over it, and it was not very noticeable. I usually just told people straight up front, look what happened to me. Gave my little warning about being vigilant about skin cancers and particularly melanomas. So it's an interesting talking point. I'm not real self-conscious about scars on my face. As I mentioned in an earlier, I believe I mentioned it, I do have a scar on my face from a dog bite when I was a child, and it's right in this area here. that microneedling process also helped diminish the appearance of that scar as well. So overall, I'm pretty pleased with the results. I expected that it would be about a year before I would feel like the scar would be barely imperceptible, or I should say barely perceptible. But here it is, 2.5 months later, and there it is. Can't hardly see it, can you? It's still there. If people look really close, they can see it. But since it has been only 2.5 months, I would expect that eventually nobody will be able to see it at all. What I want to say in conclusion is if you have to undergo this procedure, I hope you know what the expectations will be so you're not surprised. I think had I not really researched what the Slow-Mohs procedure was, I would have been pretty shocked when I saw the 2.5-inch scar on my face. I would have not expected that. So do your homework. There's at least one other really good video out there about this. That was the one that really helped me understand what I was going to be going through. And if you have any questions, feel free to ask me. I'm an open book and happy to answer any questions that you might have. Stay safe, wear your sunscreen, and if you have to undergo this procedure, don't be afraid. Thanks for watching. I'm Linda Paul.